Thank you, friends, for being here. I want to begin by acknowledging that we're on the traditional lands of the Fort William First Nations, signatory of the Robinson Treaty of 1850. We're here to talk about healthcare. We know that healthcare is always something that's top of people's minds, and I feel like more than ever in this pandemic, people are really worried about healthcare. And we're seeing in this pandemic, and as a result of COVID-19, a lot of the gaps in our healthcare system are being exposed. The fact that decades of cuts in our healthcare from liberals and conservatives has meant that our public healthcare system has been starved of some funding. We also know that a significant investment in healthcare is needed, but there's a particular piece of our healthcare system that's missing that was supposed to be there from the beginning that we have to address, and that's universal pharmacare. And the reason why pharmacare is so important, a number of reasons why, but people right now in our country, many people can't afford the medication they need to get well. And many people who have coverage or are purchasing that medication they need are spending a lot of money, and it costs them and their families a lot. We know it doesn't have to be this way. We know that we can actually work together to solve this problem. And what we've seen the liberals do and the conservatives do, instead of actually delivering on this essential expansion of our healthcare system, they've been working against it. Justin Trudeau teamed up with Erin O'Toole to vote against healthcare. He campaigned in 2019 very openly saying that he would bring in universal pharmacare. He campaigned and said that this is important and that he would make it happen. And then in his throne speech, he said again, pharmacare is important, we're going to bring it in. And at the first opportunity to actually move forward and bring in universal pharmacare, he teamed up with Erin O'Toole to vote against it. He voted against you and your families. He voted against helping people out. He voted against our healthcare system. And who did he vote for? He voted for big pharmaceutical companies and wealthy insurance companies. That's who you'd rather protect than you or your families. We have a better plan. Before we get into that plan, I want to hear from a healthcare worker who can talk about what this would mean, what it would mean to be able to invest in our healthcare system by expanding it to include pharmacare, what that would mean to people and what that would mean to you and your families. So I'll invite our first speaker to share their thoughts around what this would mean. Let's see. Oh, sorry.
That's okay. Hello, I'm here today to tell you a little bit about myself. Like so many others with dealing with a lot, I've had a back injury for 15 years, and I was also in a car accident that left me with migraines and bad memory impairments. My nurse practitioner told me about CBD drops. I gave them a few years back. I gave them a try, and they help. They help with so many different things, not just my migraines, my back pain, joint pain. They help relieve stress and anxiety, but I couldn't afford them. I'm on ODSP, and their CBD drops are not covered. So now I have to choose between the medication that I need and paying bills, paying rent, buying healthy food for my kids. Even though the drops helped immensely, for me the cost is too high. I now live every day with pain, migraines, back issues, all because I have no other choice to go without the drops. This affects my life on a day-to-day basis. Big things like being able to get out of bed, little things like going for walks with my kids. No one should have to choose between your health or your family. Thank you for your time.
Thanks so much. Thank you so much, Tammy. I really appreciate you being able to share your story. It's important for folks to know that these are the real choices that people are making, that people that cannot find the means to be able to make the choice between the medication they need or putting food on the table, helping and supporting their families. These are real choices. And our plan is to make sure no one has to worry about the cost of medication ever again. Our plan is to make sure if someone needs medication, they get it. They don't need to use their credit card, they use their health card. We know that many people in our country are paying right now for medication even though they have a drug plan. They pay premiums or co-payments. Our plan would eliminate all those costs. And while Justin Trudeau wants to team up with NDP Tool to fight against healthcare, to protect big pharmaceuticals, we want to invest in you. We want to invest in your families. We want to help out people like Tammy so they don't have to worry about the cost of the medication. We can do this. It's within our means to do it. We can make it happen. It's a matter of making priorities and making choices. We choose you, we choose people, and we choose to make sure pharmacare is included in our healthcare system, and we'll get it done. Ce qu'on a vu pendant cette pandémie, c'est le fait que beaucoup de gens ont peur pour leur santé. Et ce qu'on a vu dans le système de santé, les soins de santé, c'est les impacts des coupures des libéraux et conservateurs ont fait mal à notre soin de santé. Donc, ce qu'on veut faire, c'est d'investir dans nos soins de santé. Mais il y a un grand problème qui se passe dans notre soin de santé, c'est le fait que si vous tombez malade et vous avez besoin de médicaments, plusieurs personnes ne peuvent pas payer les factures pour les médicaments dont ils ont besoin. Donc, c'est un grand problème. Et pour plusieurs personnes, ça coûte trop cher d'acheter les médicaments. Ce qu'on propose de faire, c'est d'inclure les coûts des médicaments dans notre soin de santé. Et Justin Trudeau a promis de le faire. Il a promis de s'assurer qu'on a une assurance de médicaments universelle. Mais à le premier moment qu'on peut avancer, on aurait pu le moment d'avancer cet enjeu. Il a voté contre l'assurance médicaments et il a travaillé ensemble avec NDP Tool pour défendre les intérêts des grandes compagnies pharmaceutiques au lieu d'aider vous et vos familles. Nous, les néo-démocrates, sont différents. On veut vous aider, on veut investir dans nos soins de santé, on veut s'assurer que si vous avez besoin des médicaments, vous utilisez votre carte de santé au lieu de votre carte de crédit. On peut réaliser ça. On va investir dans nos soins de santé. On veut s'assurer que tout le monde peut avoir accès aux médicaments dont ils ont besoin et vous ne devrez pas payer la facture. Ça va être inclus dans nos soins de santé. On peut le réaliser, il faut oser et on va le faire. Merci beaucoup. Thank you so much. And with that, I'm ready to take any questions you might have.
Première question, first question, Tom Perry from CBC News.
Good morning, Mr. Singh. Thank you for taking our questions. If you're going to do this, you're going to need buy-in from the provinces. How are you going to get that buy-in from the provinces?
This was the same problem we had with universal healthcare, the exact same thing. And when we started with universal healthcare, which is now one of our national treasures, something that everyone believes in, initially every province didn't agree. And once a province agreed, we signed an agreement, and people were able to get healthcare, and it didn't matter how much money they earned. Other folks looked at that and said, well, I think that makes a lot of sense. We would like that as well. And we were able to convince provinces. Right now, what we're proposing to do would save everyone money. For each family in Canada, a universal pharmacare would save them on average $500 a month. That's whether or not they have coverage right now or if they don't have coverage. People would save at least $500 a month per family, and for many families, it would be thousands of dollars a month. This would eliminate co-payments and premiums. This would save money for not just people, but also provinces and territories. $4.2 billion of savings could be realized. Businesses would save. This just makes sense. I can't imagine why Justin Trudeau would team up with NDP Tool to vote against something that would help people out so much.
What are you going to offer the provinces? I mean, they're looking for more healthcare spending. What are you going to offer the provinces so that they'll accept your plan?
Well, first, we believe in increasing our investments in healthcare, and that means increasing transfers. But when it comes to universal pharmacare, this would save money for provinces. This would save money for people. When people see, when this is implemented in one province, that people don't have to worry about the cost of their medication, and families are saving on average at least $500 a month, if not more, thousands of dollars for some families, that is a very, very powerful convincer to say, listen, why don't we have this in our province? We'd work with provinces and territories. I know it's going to be hard work, but it's going to save families money. It's going to be good for our healthcare system. People won't get sick because they couldn't get the medication they needed. People won't get even worse because they couldn't maintain their health. It will save money for everyone, and it will make sure people have a better quality of life. And that, to me, just makes sense.
En français, s'il te plaît.
On va travailler ensemble avec les provinces et territoires. C'est normal, on doit le faire parce qu'on est dans un pays fédéral et on doit travailler avec les provinces et territoires. Mais ce qu'on peut faire, on peut montrer comment les familles vont sauver l'argent. Au moyen, pour les familles, ça va dire $500 par année. Mais pour plusieurs familles, ça veut dire des milliers de dollars de réduction dans leur coût pour le médicament. On va complètement éliminer les coûts pour acheter les médicaments. Ça va avoir une grande différence. On veut aussi investir pour augmenter les transferts en santé, mais on peut montrer aux autres provinces et territoires comment ça va aider les familles, réduire les coûts. On va aussi aider les provinces et territoires avec une coupure des coûts de 4,2 milliards de dollars. Donc, c'est gagnant pour tout le monde et on va les convaincre et on va la réaliser.
Next question, Annie Bergeron-Oliver from CTV News.
Hi, Mr. Singh. In an attempt to bring down the price of prescription drugs and to control the cost of drugs, the U.S. president has endorsed the idea of buying drugs from Canada and allowing them to be imported into the U.S. Would you allow this, or would you attempt to fight back and block the export of Canadian drugs to the U.S.?
Our priority, first and foremost, will be to make sure that we are making sure Canadians can afford their medication. That's our first priority. And why we need a universal pharmacare is to make sure Canadians can afford their medication, and why that's so fundamental. When it comes to helping other countries and making sure we're able to assist, I'm open to looking at what that looks like. But our first priority has to be to make sure Canadians can get access to medication. And we've heard from Tammy and many other people that they can't get the medication they need. They can't afford it. And our plan is to make sure we can afford it. We can actually eliminate all the costs associated with getting medication. It will make people healthier. It will make sure people are able to afford the medication they need. And it's going to save money for families, for businesses, for provinces and territories. It just makes sense. And so that's what we're going to start on. That would be our priority.
And sort of as the follow-up, your first speaker talked about needing CBD to help with health issues. So does this mean that your universal pharmacare plan would include CBD and cover the cost of cannabis?
So for medical use of cannabis, absolutely. We know that this is something that saves lives, that it's something that improves the quality of life. It's something that is important for people. We want to make sure people have a good quality of life. If someone is prescribed cannabis as a way to stay healthy or to manage or cope with pain, absolutely, it's something that we would support. We know that folks right now in our country are spending lots of money on their medication, and they can't afford it. And it would improve their quality of life. They didn't have to worry about the cost. We want to make sure we're doing that.
Next question, David Aiken, Global News.
Just quickly getting a tweet in there. Morning tweet. Sorry for that.
I'm not surprised. You
yes,
love the tweets.
I do. Good morning. I want to just come back to some of the things I was talking to Janine yesterday about campaigning in remote areas and a little bit of party plumbing. So as an NDP leader, I wondered what the party is doing to support Indigenous candidates. I know, actually, I think Angela McEwen's holding an Indigenous Victory Fund. I think that's what it's called, the party has. Can you talk about what the party is actively doing to recruit, attract, support Indigenous candidates?
Absolutely. We're really honored that we've got over 25 Indigenous candidates running in this campaign, 16 of whom identify as women. So we've got we're proud that we've been able to encourage and support and recruit great, amazing candidates and candidates that represent our country. We're doing everything we can to provide financial supports to candidates that are in need. And we're also making sure we are providing them with staffing support as well as central support. We are committed to making sure our parliament looks like Canada, and particularly helping those that have been excluded from the halls of power, have been denied access to decision making. We want to make sure that those folks are actually a part of our decision-making bodies, are a part of our parliament, and that's what we're committed to do.
And I just wondered if you might comment on yesterday in Winnipeg. I think it was Chief Sethi, might have been Chief, I can't remember, but there's an Indigenous candidate running against Nikki Ashton up in Churchill with the long name, riding. What do you think about that? I mean, Indigenous leaders have to make some choices, and they really do want more Indigenous candidates, even if it means defeating a new Democrat.
Well, I mean, it should be really clear that I support my candidate. Nikki Ashton has been a strong voice for Indigenous people and has a proven record. And New Democrats in general have shown that we are backing up our words with action. People can't afford another 4 years of Justin Trudeau. People have seen and heard the promises and have been let down, and have been their hopes have been crushed. And I've spoken with a lot of communities, and we can't take for granted what that means when you're built up and promised that things will get better, and things don't get better. Things in some cases get worse. It's even more painful when that happens. And so we are committed to making sure people get the help they need. New Democrats have shown again and again that we fight for them. we stand up for them. And when it comes to fighting for Indigenous people, we have a proven record of defending people's rights and asking for the real justice that Indigenous people need and deserve.
Prochaine question, Jean-Sébastien Cloutier de Radio-Canada.
Monsieur Singh, est-ce que vous seriez pour que toutes les provinces canadiennes fassent comme le Québec et instaurent un passeport vaccinal?
On exige le gouvernement fédéral de mettre en œuvre un document tout de suite parce que moi-même, j'ai voyagé en les provinces atlantiques et c'était un peu difficile et complexe de montrer la preuve que oui, je suis vacciné. Donc, au lieu d'avoir les systèmes différents dans chaque province, ça va être plus utile d'avoir un document fédéral qu'on peut montrer, on peut utiliser pour montrer la preuve qu'on est vacciné. Ça, c'est quelque chose d'efficace, ça rend la vie plus facile. Au lieu d'avoir des besoins différents dans chaque province, un document fédéral peut vraiment faciliter une meilleure façon de voyager entre les provinces et territoires.
In English, please.
I think the federal government should just do it. I think it makes a lot of sense to have a federal document that we can use to be able to travel around our country. We know that each province has different rules around whether they're going to bring forward a vaccine passport. And so having an easy document that you can use to prove you're vaccinated would just make sense. I traveled to the Atlantic provinces, and it's pretty complex. Every province had a different form that we had to fill out, and we had to show proof. And of course, that's very important, but wouldn't it be easier just to have one central document that we get from the federal government and we could use in any province we travel to? It would just make life easier. It'd be easier to show proof, and I think that would be an important thing that the federal government could just do.
Et finalement, bon, Mme Brosseau fait un point de presse au Québec cet après-midi. Vous allez au Québec demain. Aimeriez-vous que ce soit un game changer un peu pour le Québec, pour que votre campagne lève un petit peu, votre popularité est un petit peu moins grande au Québec qu'ailleurs? Qu'est-ce que vous pouvez nous dire là-dessus?
Madame, mon amie Ruth-Hélène Brosseau va annoncer quelque chose demain, quelque chose bientôt. Et on est hâte d'entendre cette annonce. Mais en général, on veut montrer aux Québécois et Québécoises qu'on est là pour vous. Et comment on peut oser ensemble, comment on peut bâtir une meilleure société. J'ai beaucoup d'espoir pour tout le Canada et j'ai beaucoup d'espoir pour Québec parce que je sais qu'il ne peut pas aborder 4 ans de plus de Justin Trudeau. Il mérite mieux, il mérite un gouvernement qui va livrer la marchandise, qui ne dit pas seulement les belles paroles, mais livre les actions concrètes. Et j'ai hâte de montrer comment on peut le faire comme des lions démocrates.
Next question, Creason Adjicte from CTV News.
Good morning, Mr. Singh.
Morning.
There are reports some Canadian citizens have been left behind in Afghanistan with the airport closing. What specifically do you think the government can do now to help?
This is a really difficult situation, and I just want to take a moment again to reflect on what's going on. We're hearing more and more just horrific news about the desperation of people trying to flee Afghanistan, and particularly our allies. Again, just so folks understand the severity of what's going on or the seriousness of what's going on, these are allies that put their lives at risk to support our Canadian forces. And these folks are now faced with real serious danger to their lives and their families' lives. And we promised that we'd have their back. And the reality is, at this point, Justin Trudeau has failed them. Many veterans have raised concerns and have said they've been raising concerns for months about what's going on. We also wrote, we provided our concerns months and months ago about what was going on and that we needed to evacuate our allies. And we're at this position because Justin Trudeau didn't take those concerns seriously. At this point, I can just say we need to do everything possible to work with our allies to support getting anyone and everyone that we can support to get out of Afghanistan at this point, and with a particular focus on our allies and those that supported our forces.
And Mr. Singh, do you feel you did enough while in opposition to push the government on this issue, to push for faster evacuations? In a minority parliament, opposition leaders have a lot more sway. Do you feel you and other leaders did enough to push this issue?
We absolutely raised concerns and pushed, but at the end of the day, folks are saying that they raised their concerns directly with Justin Trudeau's government, and it's Justin Trudeau that has to answer for why he didn't take those concerns seriously. Concerns were raised. We're hearing more and more reports of them, and Justin Trudeau didn't act. And again, I don't take any pleasure in saying this because it's really about the lives of our allies in Afghanistan that are at risk, and it's about the lack of action that has meant that they are now facing immediate peril to their lives. And I'm worried about them, and I'm saddened that the concerns raised were not listened to.
Next question, Leith Dunnick from Thunder Bay Newswatch.
Hi, you're meeting with local Indigenous leaders later this afternoon. Can you tell us a little bit about what your message is to the Indigenous population, both locally and, of course, nationally?
Well, I want to make sure folks know that you can count on New Democrats to be there for you. We've got an incredible team of candidates. I'm here with Yoksam and with Chantal, who are local candidates for Thunder Bay. And you can count on every one of us to listen to Indigenous communities, to fight for people. And that's what we've shown we'll do, and that's what we'll continue to do. So I want Indigenous communities across Canada and for the chiefs that we'll be meeting with to know we're not just here to give all the answers. We're also here to, more importantly, to listen, because Indigenous communities know what the solutions are. They are experiencing the problems on the ground, and we have to work together. What we've seen for a long time from Liberals and Conservatives is an Ottawa knows best, and it's not the right approach. For a lot of Indigenous communities, they just want an ally that's going to work with them. And I want folks to count on me as that ally.
Switching gears, a lot of communities here depend on cross-border traffic. What is your policy going to be on keeping the border open at this time, especially with cases rising?
Really important question. And I grew up in a border town. I grew up in Windsor, so I know a lot about what that's like, where you've got family on both sides of the border. People will live on one side, work on the other side. In fact, communities are really connected, particularly in border towns. And it's been a really tough time. With this pandemic, people have been dislocated, have been isolated from their family, and it's been really hard on a lot of folks. So one of the most important things people are telling me is that we need to know what to expect. If there's going to be a closure and you know it'll be over in a certain amount of time, it makes it easier to be able to deal with. What's happened so far, it's really hard to predict. It's been unclear. There hasn't been a lot of transparency. People don't know what the plan is. We need to provide a more clear path to when things will open up. And throughout all the decision making, we always have to follow the best advice we get from our public health to make sure we're keeping people safe. But I just want to acknowledge how tough it is for people living in border towns like Windsor, where I grew up, and in other communities across Canada where being able to get across the border is so important.
Next question, Corey Nordstrom from Thunder Bay Television.
What commitment would the federal government need to make in the manufacturing of medicine in Canada in order for costs to be affordable for all Canadians?
The two issues here. First of all, we actually believe that we need to be producing our own medication, particularly when it comes to vaccines and critical drugs. We used to actually produce medication here in Canada, and it was owned by Canadians. It was a publicly owned company, and we were really proud of this. It was one of the places that was a leader in innovating around insulin, and it was developed when there was another epidemic at the time, or a pandemic at the time. It was diphtheria. We were able to produce our own vaccines because it was so expensive to buy it in other countries. We produced it here in Canada. That is incredibly important, and we continue to maintain that we should be producing critical drugs and vaccines in our own country in a publicly owned company like that. Absolutely. What we're talking about when it comes to pharmacare for all is we can actually reduce the costs for provinces and territories if we negotiated together. If we use the buying power of our country, we could actually lower the costs of medication immediately. There's a number of steps we could take. One other step, there's a board that sets the prices for medications in Canada, and they requested just a new list of countries so that they could set lower prices. They said just by having a new list of countries, they could lower the price of medication by as much as 20% for each medication. Trudeau promised to do that, but didn't. Again, another example of who benefits from not doing that. The only people that benefited were the rich, powerful pharmaceutical companies, and people suffered. So it's a pattern of behavior here. Pharmacare would immediately lower, or in fact, eliminate the cost of medication for Canadians. That's why we want to push for it. We'd be able to use the buying power of all the provinces and territories to negotiate better prices. It would save provinces and territories money. It would save businesses money, $600 per employee, and it would make a difference in people's lives, and that's why we want to make it happen.
Nous allons passer aux questions sur Zoom. We'll go to questions on Zoom. First question, we have Alex Ballingall from the Toronto Star.
Hi, good morning.
Good morning.
Morning. I just wanted to clarify your position on the Trans Mountain expansion. Obviously, we know construction is underway. Construction has progressed in some regions of the pipeline quite significantly. If you become the prime minister and take power after this election, will you cancel that project and stop the construction and make sure it's not completed?
Thanks for the question. I've been really clear. I've been opposed to this project from the beginning. I think that we could use our money better. We could invest immediately in creating jobs for people in the resource sector and in oil sectors. We could invest immediately into renewable energy. We could invest immediately into creating jobs, and creating jobs that will be long lasting. That would be my priority. And once we form government, we'll look at the asset and make the best determination on what to do moving forward. But it's clear that my position has always been that that was a wrong decision that Justin Trudeau made.
And just as a follow, I mean, if you can just specify specifically, would you cancel? And just on a separate matter, you're pitching a $10 a day daycare program, similar to what the Liberals are proposing. Can you describe how, if at all, what you're planning for daycare is different from what the Liberals are doing?
Absolutely. What the Liberals are doing is they promised something about 30 years ago, and they took 30 years to start working on it. New Democrats believe in getting it done right away. That's the difference. Liberals have this strategy. Why deliver something when we can just promise it? And that's what they've done time and time again. They're like, oh, we'll just promise pharmacare, we'll get some votes, and then when they got a chance to do something about it, they vote against it. And they do that again and again. It's like their patented technique. We'll just promise something, and then when it comes time to doing it, we'll just say, we couldn't do it. New Democrats believe it would be vital, and we need to make it happen. It's not just an election issue for us. It's something that we've always fought for, and we want to see happen, and we believe in it.
En français, s'il te plaît.
La grande différence entre nous et les démocrates, c'est les libéraux. Ils pensent que pourquoi mettre en œuvre un programme quand on peut seulement le promis et gagner des élections en seulement les promis. La différence pour les néo-démocrates, c'est qu'on veut vraiment livrer la marchandise. On veut vraiment mettre en œuvre des programmes sociaux qui aident les gens. Ça, c'est la grande différence entre nous et les libéraux.
Next question, we have Menaka Raymond Wilms from the Globe and Mail.
Hello, good morning, Mr. Singh. 6 months ago, in February, you told the Toronto Star that you would not support a Conservative minority government led by Erin O'Toole. Your quote, if I can read that back to you, was absolutely rule that out. Do you want to change your answer now, Mr. Singh, or will you stand by that assertion that your party will not support a Conservative minority government?
Well, I'll reframe the question for you so I can answer it, because I'm running to become Prime Minister. So as Prime Minister, my goal would be to deliver help for people. I want to focus on that. That's my goal. I want to help people out. I am not supporting, I don't think Canadians can afford another 4 years of Justin Trudeau, nor could they afford another 4 years of Erin O'Toole. Both of them have shown again and again that they are opposed to healthcare. They support private healthcare. They both voted against getting long-term care profit out of the system. They rather protect private care. They voted against pharmacare. So I think that both of them will be bad for Canada. Both of them Canadians cannot afford, and they need a new Democrat government that's going to deliver the help that they need.
So just to be clear here then, so you're not ruling out the possibility that the NDP would work with a Conservative minority government?
I'm clearly stating that people will be hurt by a Conservative government and people will be hurt by a Liberal government. Both of them would make life harder for people. Both of them voted against pharmacare. Today my announcement is on pharmacare. Both of them voted against this. And the only people they benefited by doing that is big pharmaceuticals. So both the Liberals and the Conservatives are against healthcare. They both are for big pharmaceuticals. They both would hurt people. So I hope that's very clear. I think they would both hurt people. New Democrats would help people. We would bring in universal healthcare. We would lift up people. We would make the ultra-rich pay their fair share. Liberals and Conservatives have made it clear who they're defending. They voted against making the ultra-rich pay their fair share. So I think both of them would hurt Canadians, and New Democrats would help Canadians, and that's why we need to form a New Democrat government.
Next question, we have John Chidley-Hill from the Canadian Press.
Good morning, Mr. Singh.
Good morning.
My first question for you is, what is the projected cost of this program for free drug coverage? Even if you don't have precise figures, does the party have any sense as to the price tag?
Yes, we would make an investment of $10 billion. And what would happen as a result of putting $10 billion towards universal farm care, the provinces would realize a savings of about $4.2 billion. So this would be an investment that would lower the cost for provinces and territories. It would lower the cost for families, on average $500 per month, but for families that need more medication, this could be thousands of dollars of savings. And it would save money for businesses, at least $600 per employee. This is a saving for so many people. It would eliminate the cost that people have to pay when it comes to premiums or co-pays. For people who have a drug plan and those who don't, everyone would benefit.
En français, s'il te plaît.
Ils ont demandé, they asked for French as well. Donc, ce plan, ce qu'on va faire, c'est pour réaliser une assurance médicament universelle, on va mettre en œuvre, on va livrer 10 milliards de dollars pour les provinces et ça va réaliser une coupure de 4,2 milliards de dollars pour les provinces et territoires dont l'argent qu'ils livrent, donc une savings de 4,2 milliards de dollars. Ça va aussi sauver l'argent pour chaque famille, au moyen 500 dollars par année par famille, mais pour plusieurs familles, ça va dire des milliers de dollars. Ça va aussi sauver d'argent pour les entreprises, pour chaque travailleur et travailleuse, ça veut dire presque 600 dollars par année. Donc, ça va vraiment sauver l'argent pour plusieurs personnes et ça va aider tout le monde.
As a follow-up, would this plan be the same for all of the provinces? And would it cover a limited amount of drugs as the Ontario NDP proposed a few years ago?
Our plan would be a comprehensive plan, and one of the benefits of sadly being the last country with a universal healthcare plan or universal healthcare program to bring in medication coverage, we've seen other countries, and we would have a very broad formulary, so a very comprehensive, covering all the needs of Canadians when it comes to their medication, and it would save basically everyone money. Everyone who needs, whether it's people dealing with diabetes, people dealing with pain medication, people that need medication to stay healthy and to manage pain, to live a better life, we would make sure that everyone gets coverage. And we would use examples around the world of countries that have done it, because we are the last country with a universal healthcare system that doesn't include medication. And we've learned that it is possible, it can save lots of money, and it will improve quality care for people.
That concludes our press conference. Thank you. Merci.
Merci, thank you so much.